Today I will perform on how to assess the head, nose, eyes, mouth, and ears. First, identify the patient. Good morning, sir. May I know your name, your age, and your birthday?
My name is Alan Gabriel Ayabong and my birthday is December 26, 2004 and my age is 16.
Thank you, sir. And next, introduce yourself and explain the procedure to the patient. Good morning, sir. I am Judy Andabol and I'm your nurse for today. So today, sir, I will assessing or examine your head, eyes, nose, mouth, and ears. Also for your face shape and symmetry, including your sensory functions, your facial sensory functions, your eyebrows, eyes, eyelashes, your pupils, optic nerves, and so on. And next, perform hand hygiene. And put on a glove if necessary. And next, observe the size, shapes, and contour of the skull. Observe the skull in several areas by separating the hair at various locations. Inquires about injury. Note for presence of lice, nits, dandruff, or lesions. Next, palpate the head by running the pads of the finger over the entire surface of the skull. Inquire about tenderness upon doing so, and also observe and feel the hair condition. And for the face, observe the face for the shape. Inspect for symmetry. Ask the patient to smile. There should be a bilateral nasolabial fold. Assessing the sensory function, ask the patient to close the eyes, run a cotton strips over the forehead, cheek, and jaw on the both sides of the face. Ask the client if she feel it and where she feel it. Check for cranial reflex using a cotton whisk. The normal response is blinking. For motor function, ask the client to chew or clench the jaw. The client should be able to clench or chew with strength and force. For facial sensory functions, for motor function, ask the client to smile, frown, raise eyebrow, close eyelids, whistle or puff the cheek. For eyebrows, eyes, and eyelashes, using the modality of inspections. For eyebrows, symmetrical and inlined with each other, may be black, browns, or blonde depending on race, evenly distributed. For eyes, evenly placed on the inlines with each other, non-protruding, equal palpebral fissure. For eyelashes, color depends on the race, evenly distributed, Turn toward eyelids and lacrimal apparatus. Inspect eyelids for positions and symmetry. Next, palpate the eyelids for lacrimal glands to examine the lacrimal glands. The examiner slightly slide the pads of the index against the client's upper orbital rim. Required for any pains or tenderness. Next, palpate for the nasocranial duct to check for obstructions. To assess the nasolacrimal duct, the examiner presses with the index finger against the client's lower inner orbital rim at the lacrimal sac, not against the nose. In the presence of blockage, this will cause regurgitations of fluid in the plancha. In examining the palpebral conjunctiva, ask the client to look down but keep his eyes slightly open. This is to relax the levator muscles, whereas closing the eyes contracts and orbicularis muscles, preventing lids eversions. Gently grabs the upper eyelashes and pull gently downward. Do not push the lashes outward or upward. This is to cause the muscles contractions. Place a cotton tips applications above the lid's margins and push gently downward with the applicator while still holding the lashes. Invert the lids. Hold the lashes inverted against the upper ridge of the bony orbit. It's just beneath the eyebrows, never pushing against the eyebrows. Examine the lids for swelling, infections, and presence of foreign objects. For pupil examinations involve several inspections, including the size, the shape, reactions to lights is directed to observe for direct response or constrictions. Simultaneously, the other eye is observed for consequential response for constrictions. To do this, ask the client to stare at the object across the room, then ask the client to fix this gaze on the examiner index finger, which is placed 5 inches from the client's nose. Visualizations of distant objects normally causes papillary dilatations, and the visualizations of nearer objects cause the papillary constrictions and convergence of the eye. The optic nerve is assessed by testing for the vision's acuity and peripheral visions. Visual acuity is tested using the Skelen chart. The chart has a standard number at the end of each line of letters. This number indicates the degree of visual acuity when measured a distance of 20 feet. By doing this, only one eye should be tested at a time. The other eye should be covered by the opaque card or eye cover, not with client's fingers. Make the client read the chart by pointing a letter randomly of each line, may be started from largest to smallest or vice versa. Assessing for peripheral visions or visual field, the assessment of visual acuity indicates of the functioning of the macular area, the area of central visions. The examiner and the client will sit or stand opposite each other with the eye of the same horizontal level with the distance of 1.5 to 2 feet apart. The examiner holds an object such as pencil or the pen light, and his hands gradually move from the periphery of both directions horizontally and from above and below. Normally, the client should see the same time the examiner sees it. The normal vision field is 180 degrees. Assessing the ears, inspect the auricles of the ears for parallelisms, size, positions, appearance, and skin color. Palpate the auricles and the mustard process for firmness of the cartilage of the auricles, tenderness when manipulating the auricles, and the mustard process. Inspect the auditory meatus of the ear canals for colors, presence of a cerumen, discharges, and foreign bodies. For adult, pull the pinna upward and backward to straighten the canal. Meanwhile, for children, pull the pinna downward and backward to straighten the canal. Assessing for nostril, the external portions of nose is inspected for the following: the placement and the symmetry. The assessing for paucity of nares, done by concluding the nostril one at a time and noting for difficult in breathing. The external nares are palpated for displacement of bones and cartilage. For tenderness and masses, the internal nares are inspected by hyper-extending the neck of the client. The external nares are palpated for displacement of bones and cartilage. For tenderness and masses, the internal nares are inspected by hyper-extended the neck of the client. The ulnar aspect of the examiner's hands over the forehead of the client and using the thumb to push the tip of the nose upward while shining a light into the nares.